The body is then wrapped with 2 cloths. The cloths are fastened with linen strips. The body is then put inside a wooden casket. The wooden casket is in place inside another casket. Embalming of a body is a popular and effective way of preservation. Embalming, however, does not preserve the body forever. It only delays the process of natural decomposition. The process of embalming is very complex, invasive, and expensive. It is also very evident upon inspection. The process of embalming is as follows. The body is placed on a stainless steel or porcelain table. It is then washed with germicide insecticide. The insides of the mouth and nose are swabbed with this substance as well. The body is then massaged to prevent rigor mortis. Cream is worked into the skin to keep it soft and pliable. Cotton balls are stuffed into the nose, under the eye caps and eyelids, and into the mouth to keep plump facial features. Gauze is also put into the throat to absorb fluid present from decomposition. The mouth is tied shut with wires, and glue is sometimes used to close the eyelids and the mouth in an appropriate pose. While the blood is being drained from the body, embalming fluid is then injected into the body by way of the main artery. Approximately 2 gallons of embalming fluid is pumped into the body. With a pointed suction tool called a trocar, the stomach, bladder, large intestines, and lungs are punctured. This withdraws the gas and fluids from these organs. Cavity fluid or formaldehyde is then injected into the torso. All remaining body openings are packed with gauze to prevent seepage. All incisions or holes in the body are sewn closed. The body is then washed and dried. Makeup is used on the face and hands. Nails are manicured or glued together if necessary, and missing facial features are molded out of wax and fastened on the body. The body is then dressed and placed in the casket, ready for exposure or funeral display. The bodies of the incorruptibles vary in their conditions. Some are soft and flexible, while others are more stiff and brittle. Some are dry, while others are moist. A few of the incorruptibles leak clear oils, called chrism, or even bleed. The fluid which leaks from a certain number of incorruptibles is collected and distributed among the sick. There have been many miracles attributed to this fluid. A flow of blood was discovered on the 24th day after St. Bernardine of Siena's death in 1444. The blood was seen emerging from the saint's closed casket. It was later discovered that the blood was coming out of his nose. St. Bernardine bled so profusely that it soaked the pillow and habit in which he was buried. Before burial, the saint was changed, and the blood-soaked pillow and habit were cut up and distributed as relics. The body of St. Charbel Maclouf was found floating in a muddy pool 45 days after his burial. This was due to a heavy rain which reduced the cemetery where he was buried to a swamp. After his body was discovered, it was dried, reclothed, and put in a wooden coffin for reburial. It was noticed during this time that the body of St. Charbel Maclouf was exuding a blood-like fluid. The presence of this fluid was so abundant that the body needed to be changed into dry garments twice a week. In 1927, his body, still flexible, was exhumed and moved to a shrine. In 1950, a group of pilgrims visiting his shrine noticed liquid coming from the tomb. This gave way for another exhumation. The oily substance was collected and distributed among the sick, and is said to be attributed for many miraculous cures. 9 months after his death, the body of St. John of the Cross was exhumed. After the discovery of his fresh and intact body, a finger was removed for a relic. When the finger was removed, blood appeared as if he was a living person. Through the centuries, his body was exhumed 4 times. the body was still found to be fresh and flexible during the last exhumation in 1955. Due to burial complications, some of the incorruptibles were left fully exposed directly after their deaths. A few of the incorruptibles were left exposed for more than 2 weeks. Even with this prolonged exposure to air, flies, and bacteria, these incorruptibles remained unaffected. Saint Bernardine, who was previously mentioned, was left exposed for 26 days because of the large crowds of mourners who came to visit his bier. Along with his talent as a writer, Saint Bernardine was known for the symbol he created along with Saint John Capistran, which represented the holy name, IHS. The body of Saint Antonius was left exposed for 8 days. During these 8 days, which should have brought his body halfway through stage 2 of the decomposition process, the body remained flexible and intensively fragrant. The body of Saint Antonius is still remarkably preserved, and can be seen in the Dominican Church of San Marco. Saint Antonius died in 1459. He was well known for making the library of San Marco accessible to scholars. It was thought that this was the first public library in Europe. The body of Saint Teresa Margaret of the Sacred Heart was left exposed for 15 days before she was laid to rest in the wall of her monastery in Florence. It was documented in the saint's burial records that her skin changed to a rose-like color from the purple tint it had developed during her gangrenous condition, which led to her death. It was documented that the saint's body exuded a sweet odor. The saint was exhumed in 1805, 35 years after her death. Her body was examined by 3 doctors, who reported that the body was a flesh color, somewhat dry, but nevertheless surprisingly elastic and pliable. The wound made in her right foot by the surgeon that bled her, still visible, but healed with good color. Saint Teresa joined a convent in Florence, Italy at the age of 17. She died at the age of only 23, but was well loved and admired within her family and religious order. Saint Teresa was well known within her order for curing the sick. Saint Angela Merici was left exposed for 30 days before burial. This exposure should have taken the body halfway through stage 4 of the decomposition process, but her body remained unaffected. Saint Angela died in 1540. She was exhumed several times before her final exhumation in 1907, after which she was permanently placed in her glass reliquary in Brescia, Italy. Her body is still visited today. Saint Angela is well known in the Catholic community as being the foundress of the Ursuline order, the first teaching order of the Catholic Church. Because of the lack of scientific explanation, there have been many skeptics pertaining to this incorruptible phenomenon. Most of the incorruptibles have not been examined by doctors because of the Catholic Church's protection of them as relics. There are a few, however, which have been medically examined. The body of Saint Bernadette was exhumed in 1879, 30 years after her death. The doctor who conducted her examination wrote, "The body appeared to be absolutely intact and odorless. There was no smell of putrefaction." Another exhumation occurred in 1923. During this examination, the body was opened. The doctor found the organs to be supple and the liver soft and almost normal in consistency. There is no scientific explanation given for the amazing preservation of Saint Bernadette's body. The body of Saint Teresa Margaret of the Sacred Heart was examined by 3 doctors. During one of her exhumations, they reported that the body was of flesh color, somewhat dry, but nevertheless surprisingly elastic and pliable. The wound made in the right foot by the surgeon that bled her was still visible, but healed with good color. The body of Saint Teresa of Avila was examined by doctors after it was moved from its original resting place. The doctors reported it was impossible that the body's condition could have had a natural explanation, but that it was truly miraculous. For after 3 years, without having been opened or embalmed, it was in such a perfect state of preservation.